Hello, everyone. I'm Scott Wright, Professor of Medicine at Mayo Clinic and Associate Editor of Mayo Clinic Proceedings. Today, I'm joined by Dr. Leonard Berry. Professor Berry is a distinguished professor at Texas A&M in business, finance, marketing, truly a global leader in thought about these matters. And we're so delighted, Dr. Berry, to have you join us. Welcome to the Mayo Clinic Proceedings podcast.
Oh, thank you, Dr. Wright. It's my pleasure.
Dr. Berry, I know you've published a very good book about Mayo Clinic and some of the management practices that you observed when you were doing some time in Rochester at Mayo. But for our audience, I wonder if you could maybe share your background and how you got interested in doing marketing and business and finance and having a career as an academic.
Yes, so just briefly on my background, Dr. Wright, I am a business professor, as you mentioned, at Texas A&M University, and my area of specialty has always been the marketing of services and quality of service. And the reason for the emphasis on quality of service is because you really can't market a service if the quality is poor. And for the first half of my career, I focused on commercial enterprise, on corporate service quality. But then in 2001, 2002, I did a sabbatical leave at the university and went to Mayo Clinic as a visiting scientist to study healthcare service. And that was my first toe in the water studying healthcare service as opposed to service in general. And I was so fascinated. It was so unique a service, so different from retailing or banking or telecommunications or insurance, the kinds of services I'd studied before. And I started learning about all of the problems and challenges in healthcare. And with my business background and maybe my just optimism, general optimism as a researcher and a person, I thought, these problems are not intractable. We can fix them. And I have a background that's different from most people who work in healthcare, business background, service background. Maybe I can help. And so that sabbatical leave at Mayo Clinic was fantastic for me. It really was life-changing and certainly career-changing. And I went back and told my colleagues that from this point on, I'm going to devote my time and effort to studying health service research, health service quality, see what I can do to make a difference. And that was more than 20 years ago now, and I've been true to that. And I've been to a lot of other health systems studying since Mayo Clinic, but Mayo Clinic got me my start.
Oh, that's marvelous. And what are some of the differences that you discovered between the healthcare sector and prior to that, the non-healthcare sector? And are there sort of unique issues within healthcare that our audience, mainly physicians and nurses and medical students and residents, can learn to understand what a unique industry we're in, or are we not in such a unique industry, right? Are we just like any other industry, just that we're touching people more than maybe some?
No, I was fascinated when I first started studying healthcare at how different healthcare service was from other commercial services that I had been studying my entire career. One of the big differences, Dr. Wright, between other services and healthcare services is in healthcare, your customer, who is so unique, we don't even use the word customer, we use the word patient. But your customer is sick, typically sick, and that presents unique challenges to the provider of the service, to the clinician, when your customer is sick and presents with uncertainty, with fear, anxiety, pain, some combination thereof. And so that's one big difference. Another big difference is the high stakes of quality in healthcare. In healthcare, if our quality is poor, we hurt people. We can hurt people. That's generally not true if our quality is poor in most other services. There are a few, like the airline service, where we put our life in the hands of others, but not many. But healthcare is one of those services. And so the stakes are very high. And they're not only high for the consumer, the patient, but also for the clinician who's providing the service. I've interviewed clinicians, for example, that have encountered malpractice issues. And for some of them, it was life-changing and career-changing for them. The intense pressure to perform consistently at a high quality, both technically and also in terms of the the interaction, the behavioral, the behavioral service you provide your patient is a high bar. Being a physician is, I believe, you would know better than me, Dr. Wright, because you are a physician. I'm not. But being a physician has always been a challenging position. And I think today, today, with all that's going on, it's perhaps one of the hardest jobs of all job categories that exist. And so I have a lot of empathy for people that choose this line of work, not only physicians, but nurses and others that work in healthcare. It's a very challenging period right now. And burnout is just that we hear so much about is just the tip of the iceberg in terms of all of the underlying challenges of working in healthcare today.
Well, thank you, Dr. Berry. That's very insightful. Um, your work at Mayo was done in the early 2000 era, and then you published a great book, Management Principles of the Mayo Clinic, around 2008, that I've had referenced many times in discussions at Mayo when we talk about what we do and why we do what we do. We've all lived through, since 2020, something called the Great Pandemic.
Yes.
And that's kind of turned healthcare in a way on its side, if not upside down, with burnout and other things. Where do you see the state of healthcare today with regard to where it was pre-COVID? What are your high-level observations about where we are? And then I may ask you, if you would, please, to prescribe for a bit for the medical community, what you think we can do to regain service at an excellent level and continue to improve it.
I think the pandemic had several very serious implications for healthcare today and tomorrow. For one thing, it exposed the business model of hospitals for what it really is, but had remained relatively unexposed before the pandemic. And it exposed that hospitals have a difficult time making a living unless they're doing procedural work. And when we had to turn the surgery suites over to taking care of COVID patients, it decimated the bottom line of America's hospitals. And as a result of that, I think there is more creative thinking today than perhaps before the pandemic on alternative business models for inpatient care or for serious ill patients. Hospital at a home is a growing trend, as you know, Dr. Wright. I think that's an example of an innovation that has been perpetuated and stimulated, encouraged by the pandemic and the overcrowding of our hospital beds. So that's one thing. I also think that it certainly exacerbated the issue of burnout and perhaps even more importantly, the issue of trust between healthcare workers and healthcare institution leaders, because there were just too many instances during the pandemic when the essential workers, the nurses and the doctors and the ambulance drivers and everyone else, had to go to work and be exposed, and sometimes be exposed to serious illness, including life-limiting illness, without preparation, either from a training standpoint or from PPE, PPE standpoint, having the right protection. And at that time, a lot of senior management were not doing what they needed to do, and as leadership, and that's protect. Let's protect the people that work for them, that work for the institution. There is no higher purpose for a healthcare leader than to protect physically, financially, morale-wise, protect the staff that actually serve the patient, that actually are the hospital to the patient. And I was frankly appalled that so many physician leaders, not physician leaders, many were non-physician leaders, but so many leaders stayed home. They did their meetings by Zoom. They basically stayed home out of harm's way, while their people were not able to stay home. That created a trust gap that I think exists to this day, perhaps even worse this day, because of all the financial pressures raining on healthcare, in part because of the pandemic, and what we went through, in part because of the labor shortages and what we're having to pay in healthcare for labor, in part for the supply chain issues that came after the pandemic and what we had to pay for supplies. So there's a lot to be concerned about today. And I do study this. I write about this. I often write in the Mayo Clinic Proceedings. It's one of my favored outlets, and I'm very grateful for the support I get from the Proceedings. It's such an outstanding journal. And I've written about some of these issues in the journal.
Thank you, Dr. Berry, and we appreciate having you as an author in the Proceedings. Your work is always welcome, and it's we try to provide as a journal not just the hard science medicine perspective, but also humanities and other analyses. And I think what you've just described resonates so closely with our medical and nursing communities. I too have been just quite surprised at the lack of trust and the anger that I've seen erupting across the United States and frankly across the world. If I might ask, we're constantly hearing the pressures about the finances of medicine. It's 20% or so of the GDP. I can say that, but as the only non-economist among my children and my family, I may not fully appreciate what all that means. But what advice would you give today to physicians, nurses, and healthcare leaders to sort of regain that trust and to regain that sense of a higher calling? Many of us, I think, went into medicine because we viewed it as a higher calling to really help humanity.
Well, the very first, Dr. Wright, a piece of advice that you've asked me to give to healthcare leaders about the current state of affairs is they need to spend more time on the floor interacting directly with the people that directly serve patients. You can't effectively lead in healthcare today with all of the pressures raining on people who provide healthcare services and the people who lead healthcare organizations. You cannot effectively lead today from your office. You need to be present. You need to be visible. You need to be ready to listen to the rocks in the shoes, the rocks in the shoes, the people providing the service. Your job as a leader is to support, to protect, to remove those rocks, to make the work more manageable, make the work more, more fulfilling. And that's what leadership is all about. It's what leadership has always been all about, and that's what leadership will always be about, is making sure that you earn your leadership, that you earn your title. Titles don't make leaders. Behavior make leaders. And so the very first piece is what I would do if I was a CEO of a health system, is I would create every single week, I would create throughout the system what I would call a no meeting day. A no meeting day for all the senior executives and administrators. They can't form any meetings. They have to go out into the field and interact with the staff. A good day for that might be Thursday. Friday probably isn't a good day at the end of the week, and Monday isn't a good day because it follows the weekend. Maybe a Thursday. And it's the health system policy. Executives are not going to meet on Thursday. They're going to have that time for the staff, to be with the staff. And doing regular rounds in the clinics, in the hospital, very, very important. Another thing that needs to be done, and that is, and every health system can do this, and actually have some fun with it, but also do some good, a lot of good. And that is create a competition that any team or individual employee can participate in, submitting a let's get rid of this stupid thing idea. Because all health systems, all organizations do some things that are really stupid and wasteful and demoralizing to the people that have to do these stupid things. And there's so much waste in healthcare. We don't need to be spending more money in healthcare. We actually need to be spending less money in healthcare in America, because every study I've seen, and there have been a lot of them in the medical literature, peer-reviewed studies, have shown we're wasting at least 30 cents on a dollar, up to 60 cents on a dollar of healthcare spending. So if you're spending over $4 trillion, and if you can have the courage to identify some of that waste and reallocate it to true service, to true valuable care, to support the people that provide the care, then we don't need to be spending so much money. By wasting so much on healthcare, Dr. Wright, we're robbing from other parts of society. Think about it that way. From the schools, how little we pay school teachers, and the shortage of school teachers today. We have shortages in guards in our prisons today, huge shortages. We're not building the roads the way we need to build the roads, and repaving the roads, and investing in the infrastructure in this country that we need to do. We're not doing enough for low-income people, and all of the disparities and socioeconomic and issues that we have in healthcare are part of the great tragedy of healthcare today. So enough on that. I sound like I'm on my soapbox, which happens commonly, but you get the drift. So yeah.
No, thank you. I think you've earned the right to make any of the comments you want in healthcare, and I think you've earned the respect of the nation's healthcare system as a true expert. And I think your judgment on on these issues is it's just a clarion call to all of us. But as you say, healthcare does have a lot of redundancy and waste that could be repurposed either to other things or within healthcare for better things. In many respects, we've built the greatest healthcare system in the world, as well as the most expensive system in the world. And I think, as you've just rightly point out, quality and value ought to be at the forefront, and we ought to challenge ourselves every year to refine that. I think it's profound, and I really want to commend you for your work. Thank you for bringing the discipline and the rigor of your scientific background to healthcare. I think it's helping us to see it from a different perspective that's missing so often, but we don't. We need to be open to it. We need those blinders removed. So I'll turn it back to you for any last words of wisdom or any other things you might want to share with our audience before we finish.
Let me close with perhaps a final thought about what we need to do. And this is something that I've written quite a bit about recently, and that is the power of kindness in healthcare. We've kind of lost our way when it comes to kindness. And when your customer is afraid, when your customer is frightened, when your customer is in pain, when your customer has serious disease, when their family is afraid and frightened, kindness in the interaction between the patient and the family and the clinician has such a profound impact. I've interviewed in my work over the last 20 plus years hundreds and hundreds and hundreds of patients, as well as hundreds of clinicians, because I go in the field to do this work, just as I did at Mayo Clinic. I don't stay in my office. I go to the health systems, and I watch and I observe and I interview. And I see the power of true kindness. And so many patients I've interviewed will recall something that happened 6, 10 years ago, something that a kind, generous act on the part of their doctor, maybe, or their nurse, that their doctor or nurse would never remember 6 or 8 years ago. But that patient still remembers. And I'll end with this story, just one example, and I'll end with it to illustrate the power of just real kindness to each other. And by the way, one of the takeaways from Mayo Clinic, and that I write about in the book, Management Lessons from Mayo Clinic, one of the takeaways is the kindness I saw in the Mayo Clinic culture when I was there. Not only doctor to patient, but also doctor to doctor in the way they share and help each other with a particular patient. Take time from their patient to help another doctor with the other doctor's patient, which is, I believe, Mayo's core competency is the pooling of knowledge among specialists, but also the kindness that I saw between physicians and nurses, which you don't often, or at least always, see in other health systems. And Mayo Clinic is a kind culture. And I believe that's perhaps one of its most prevailing strengths. And when I have the opportunity to come back to Mayo and speak, which I typically come back once a year to talk, give a talk, I talk about Mayo can't lose what makes Mayo Mayo. And that its culture of team-based medicine, its culture of putting the patient's needs first, and its culture of being kind to one another. And so the story I promised about 3 minutes ago, I promised it, but here it is, finally. True story that I got from a doctor I interviewed for a speech that I recently gave. So this doctor, gastroenterologist, was driving home. He lives in Atlanta. He was in heavy traffic on Friday afternoon after a hard work week. He was driving home. He was almost home. He told me he was so tired from the week he was fried. That was the word he used. And he had his iPad in his front seat of his car. And I think at a stoplight, uh, he got a notice that a patient that he had been seeing, the results came back, and her mass in her stomach was benign. It was good news. And it was a Friday before a long weekend, a 3-day weekend. So the doctor had a choice. He could continue to drive home, and then on Tuesday of the next week, he could call the patient with the good news. But he made a different choice. He turned his car around and drove back to the hospital and found the patient's number and all of that and called her with the good news. And she burst out crying in gratitude. And then he started his long trip home. And that's the power of kindness. We need to get back to that in healthcare with all the technology, all the new drugs, all the new remedies. We need to get back basic 101 kindness. So I'd like to leave you with that message.
Well, thank you, Professor Leonard Berry, Texas A&M and Mayo Clinic scholar. We are absolutely honored and extremely grateful that you shared these thoughts with us, and your ending was every bit worth the wait that you asked us to wait for. So thank you very much.
Thank you, Dr. Wright.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.